Afternoon, and thank you for taking the time to join us for this webinar. My name is Lucian Hofart, member of the Knowledge Management Working Group. I'm also the Vice Chair of the Policy and Strategy Working Group on Stigma and Discrimination, as well as the Chair of CARIFLAX, which is the Caribbean Forum for Liberation and Acceptance of Genders and Sexuality. I'm pleased to be your moderator for today's webinar. Let me extend a warm welcome to you on behalf of the Pan-Caribbean Partnership on HIV and AIDS and PANCAP's director, Mr. Derek Springer, as well as the chair of the Knowledge Management Working Group, Ms. Satrian Martin. And thank you in advance for joining us. Let's go for some logistical notes. Your mic will be muted during the session. If you have any questions during the presentations, please just put them in the sidebar. Second, after the presentations, we'll have a small questions and answer segment. And so again, please just put your questions in the sidebar. After the questions and answer segment, we'll have a poll up on the screen and we would encourage you to participate. And finally, the webinar will be recorded and shared on PANCAP's website for the benefit of the greater partnership. I'm not sure, something's happening here. Can you still hear me?
I can hear you. This is Stefan. I can hear you, but in
Yes,
some
thank you so
instances
much.
it goes in and out.
Yeah, something's happening on the screen. I'm not sure what's happening. So I
Okay.
was a bit confused, but we'll go on. Today we'll hear from Ms. Alexis DiMarco, who is a social justice and human rights defender, an intersectional advocate with specific focus on LGBTI rights, women's rights, trans rights, youth development, sexual health and reproductive rights, rights for the vulnerable and marginalized groups, the disabled and the elderly. She's the founder and CEO of the DiMarco organization, is a member of the Bahamian Trans and Intersex United, and is the chair for the United Caribbean Trans People Network, otherwise known as UC Trans, as well as vice chair of the Youth Steering Committee for PANCAP. She's one of the voices and advocates in the Bahamas who is internationally respected for her work throughout the Bahamas and the Caribbean region. After that, we'll have a presentation by Dr. Waters, who is currently the head of programs at the Caribbean Vulnerable Communities Coalition, CVC. And CVC is is the Caribbean's largest organization, coalition of civil society organizations and community leaders representing over 40 CSOs that work with highly stigmatized populations vulnerable to contracting HIV and AIDS. He's a medical doctor by training who has worked in the areas of sexual and reproductive health with key populations for the last 20 years. Dr. Waters has extensive experience working in resource-limited settings in the Caribbean and Latin America. He's trained in community-engaged research approaches. Much of his work has been conducted in partnership with local community members and organizations, as well as local authorities. And our final presentation during this webinar will be from Stefan Duncan. Stefan is the admin and outreach officer for Transway, Jamaica. Just 23 years old, Stefan enjoys advocacy and has roughly 4 years of experience in LGBT advocacy as admin and outreach officer. Stefan's main responsibilities are day-to-day administrative duties of the organization and also acting as the main contact for the trans community and the organization. He's also responsible for executing, planning, and coordinating the events of the organization, and also maintaining volunteer efforts. So we'll have three presenters for today who I've just introduced. We'll start with a presentation by Miss Alexis DeMarco.
It is with great pleasure to be a part of this PANCAP webinar series on trans persons in the Caribbean. My name is Alexis DeMarco. I am the founder of the DeMarco organization, also the elected chair for the United Caribbean Trans Persons Network, known as UC Trans. So it gives me great pleasure to give a brief overview of the situation of trans persons in our Caribbean regions. Many trans persons in the Caribbean experience gender-based violence throughout their lives. Sometimes this, is a hindrance to them accessing services, which will contribute to health outcomes which are really poor and the quality of their life. When visiting a healthcare facility, many of them face stigma and discrimination just at the parking lot level to the door. These abuses can range from nurses or parking lot attendants gossiping about them, providing insults, calling them names such as he, she, oh, look at the it, those types of experience, even refusal to use their chosen name, the name that they identify as when they go to the front receptionist area. There's always some issue with using their name. So these are some barriers that they would face in accessing healthcare, being a trans person living in the Caribbean. The economic, physical, sexual violence, and other human rights violations based on their gender identity and their expression causes them to suffer physical threats, assault, even harassment, and sometimes, believe it or not, they are denied services. The access to mental health services are mostly non-existent unless you have the financial means to access this service. Many trans persons in the Caribbean don't have access to this service. And the thing about it is, I was talking to a trans person in Barbados, and she told me how difficult it was for her to navigate the healthcare system just for a mental breakdown issue that she was having at the time. So we see there's a lot of work to be done in our healthcare facilities for trans persons. The thing about it also is that service providers, they even fail to meet the specific needs of trans persons. Some of them say they don't know. Some of them say they use their religious beliefs as a barrier that they don't have to serve the individual. And these barriers deters trans persons who may want to seek healthcare services, even just for basic healthcare, and they don't. The thing about it is, too, is that although there are legal protections, meaning that they have policies in place, because when you do your research, you will see that policies in hospitals do have this non-discrimination clause, and we serve all persons, but sometimes those are non-effective. And states don't meet these obligations. Hospitals don't meet these obligations. So to respect and promote a full quality of life for trans people accessing healthcare in the Caribbean, it's a beginning process and it's a long journey, because the thing about it is we need lots of sensitization to the issues. Healthcare workers needs to be sensitized to this community. I can recall going into the hospital with a trans girl, navigating her through services, and she just got these dirty looks just being in the waiting room. And then other patients were looking at her, harassing her. She was subject to on-the-spot preaching by the nurse, reproach from nurses and doctors. When they looked at her identification and they saw her gender marker had M, that's when they called all the nurses and the doctors to say, look at this person. And It just started right there. So she felt very, very uncomfortable. Had I not been there, she probably would have turned away from getting her services. But I do feel that peer navigation is an effective tool for trans persons to navigate healthcare systems. And one thing about it is that the effect of being discriminated in a service that's not, it's not optional that you serve somebody, but it's your right. Healthcare is not an option for us. Healthcare is our right. As a citizen for any country, trans persons, their access to healthcare is not optional. You don't decide if you should treat a trans person. They're a citizen of that country, they should be treated. And the thing about it is that there is not enough sensitization in hospitals to try to help doctors, nurses. And when I say doctors, you have some doctors in the Caribbean who won't even deal with trans persons. So I think the whole thing about it is we need to start sensitizing our doctors, our nurses. Like I said, the discrimination starts from the parking lot to the door. And the thing about it is we can only begin the process of sensitization by using persons within the trans community. So persons can be able to identify and see who these persons are, and to be able to say, okay, how do I approach you? How do I address you? What are some of the things and challenges that you face? And the thing about it is after leaving that hospital, it's a challenge for most of them, even getting transportation to hospital and from hospital. They have to take public transportation, most of them in the Caribbean, and for them to have to dress down. I recall an incident of actually a program manager in somewhere in the Caribbean telling one of the trans persons, oh, if you want to be helped, why don't y'all just put on a cap, a jeans, and a t-shirt? And that really made me very squeamish and squeamish when I heard the story about it. So even in our programming, we need to sensitize persons who are working at the program level, working with key populations and sensitizing them to the needs of trans persons. So these are some of the hindrances and just a brief overview of what's going on in the Caribbean. And I think through our collaborative effort and finding best practices, we can be able to try to at least eliminate some of the stigma and discrimination faced by trans persons and the barriers for them accessing health care services in the Caribbean region. So I hope this helped you out a little bit with my overview.
So Stefan, if you're ready, we'll have your presentation now. I'm also not sure if everyone heard me thank Alexis for her bit and mention that she's not present at this time, but we were still able to get her contribution. So Stefan, if you're ready.
Hello?
That's Stefan.
Okay, so you're able to hear me?
Yes, we're able to hear you. Go on, Stefan.
All right, so I'm very pleased to be a part of this panel, and I'm very happy that I was given the opportunity to represent Transwave regarding discrimination and stigma as it relates to HIV within, specifically on the Caribbean at a wider level, right? So in this era where most of the world is modern, trans people are still among the most marginalized of the LGBT community. We face stigma and discrimination at alarming levels, particularly for trans people of color. We are excluded from being a part of our societies because of our gender identities. As admin and outreach officer for Transwave Jamaica, I am tasked with documenting human rights violations for members of the community. It is shocking the amount of reports of discrimination and violence portrayed to trans people. People are human, humans like myself, yourself, your mom, your dad, your sister, your brother, aunt, uncle, nephew, niece, or grandmother. Trans people in Jamaica are at a disadvantage as they are sometimes prevented from completing school due to instances of discrimination and violence portrayed. We clearly see where there is a behavior of forcing our trans kids from their homes, leaving them to fend for themselves, now homeless, neglected, unloved, and in most cases violated and hurt. They have to particularly adapt a nomadic lifestyle, and sometimes this is the only way they can survive, doing inhumane and morally deplorable things to make ends meet. not being able to express themselves mean that they would be forced to turn to alternative means of sustaining themselves. Members of the community are faced with discrimination from all angles, which results in them not being able to access resources through means. So sorry, which results in them being able to access resources through a means not so discriminative, but one that allows for them to express themselves and expose them to multiple dangers. This field is the art of sex work. We also see vast stigmatization in this field, as sex workers are normally said to be HIV positive. There is also an air of danger, as these persons from time to time have to endure having sex with some of their clients, violent clients at that, for more money for not using condoms. Access to adequate healthcare is also an issue. Untrained healthcare providers find it hard to approach and deal with persons of trans experience and identity. For us in Jamaica, we have done some amount of trainings with healthcare providers, not at all exclusive, but it helps nevertheless. I can remember once participating in a conversation regarding sensitization trainings with doctors and healthcare providers. It was explicitly said by one of the senior doctors that he would not treat a member of the community. In order to alleviate this issue, I think a standardized approach should be taken, ensuring that policies are put in place to prevent doctors and other healthcare providers from discriminating. Additionally, there is the issue of persons being counted as numbers. This, I must add, is a big problem for persons of the community. The fact that they are only seen when they need to add to an organization's HIV responses, reach, and test targets has for long been and still is an issue. What has worked for us is to build relationships, lasting relationships, and one that will not be solely based on testing and targeting needs. Overall, the work of NGOs, in my opinion, lack the psychosocial to communicate with trans people on a level that will be beneficial to themselves and the operations of that organization. Active trainings for staff is one main way that I believe can effect change. We find that most staff are sometimes not adequately trained. Simple misgendering in some cases are very monumental and affect the responses we receive from members of the trans community. The use of preferred pronouns should be something that is true when dealing all here today to seek to take the time to implement policies that will have positive changes to the persons we serve. Health and well-being does involve knowing your status, but will we achieve the goal of the 1990 targets if we continue to neglect our trans people? The simple answer is no. There is so much trans people and persons living and existing as who they are. Inclusion for us would mean having gender recognition legislation in place to allow us to be able to have our genders legally recognized. We'd also need anti-discrimination legislation as well to provide adequate protection against discrimination. At Transwave Jamaica, one of our core objectives is the mental health trans month support group sessions, as well as our fitness brand that we have established, Trans Active. Additionally, we focus on creating spaces where people feel comfortable and appreciated. It would also be important to have trans people and their issues woven into programs and policies to ensure that the community is fully integrated and represented at all levels. We urge decision makers to create policies that reflect full consideration for the humanity of trans people. This means that trans and gender non people are able to update their gender markers on local legal documents, access gender affirming healthcare and social support services without discrimination.
Yes, so there's a question here from an attendee who is saying that they appreciated the presentation, the experience that Alexa shared, and the point that she made on peer navigators. It seems as if it's a really great mechanism, but would want to know what happens when they're not available. When there are no peer navigators, what happens?
Ideally, as someone who used to work directly in the HIV response, I used to work with a local NGO here in Jamaica that does testing and screenings, but not treatment. What I found is that from time to time, the numbers that we had to work with, whenever we test and we reference persons to getting treatment at an additional facility, we found that over time, that relationship that we had with them broke down, which would kind of have persons finding it difficult to retain the care that they're getting or to remain on ARVs. So I would think that if it is that the peer navigators are no longer available, then we would really have a crisis as the numbers for retention to care would start to rise. So I personally believe that the only way that we can actually, I'm really not seeing a way that we could actually work around that, right? Because the system has evolved to that stage where persons really and truly are dependent on the peer navigators to help them through certain crises that they're going through. I find that social workers are working with some of these organizations now, and they have started to implement some level of psychosocial support regarding the care that we give to these persons. But really and truly, without the peer navigators, I'm not sure how it is that these persons will continue to get the help that they so desire.
Lashan, there's another question.
Yes, go ahead, Shanti.
Go ahead. Okay, thank you. This question is coming from Gail Knudson, who is the president of the World Professional Association of Transgender Health, WPAT, and she is asking, would it be helpful to have WPAT partner with members of the civil society groups for educational programming for the medical and mental health professionals around transgender care? And I think it's probably linked to the comment that Alexis made in her presentation and Stefan, that healthcare workers in the region are not necessarily sensitized and equipped to deal with transgender health.
Do you guys want me to go ahead and take that one?
Sure, go ahead, Stefan.
All right. So as I was mentioning in my presentation earlier, I was saying that I can remember participating in a conversation with some doctors and nurses that they were training, sensitizing on ways to approach and deal with members of the LGBT community. And it was fascinating, as I said, that a senior doctor, one who's employed to the Ministry of Health here in Jamaica, said these words, and I quote, "I will not entertain or treat a person from the community." What this does to the community is it really affects the community negatively. When you think about the fact that we are not being given the space and the opportunity to access public health, it's really monumental and it's really devastating. I think that greater partnerships would be necessary. Building networks with the health organizations, because the fact is not a lot of trans persons are able to afford the private doctors that I would be able to afford. So it's really difficult from time to time for persons to access health. So partnerships are necessary and important in sustaining the population of the community here.
Excellent. Thank you so much. Stefan. And I just want to say we're very pleased that the president of WPAT has joined us on this webinar. Maybe to add a little bit to what Stefan said, I think the whole idea of transgender health, it has advanced in the region, but it's still, I would say, relatively new, and so there is that need for healthcare professionals to be able to deal adequately with transgender health. And I do agree with Stefan. The more collaboration we have, I think, the better it is. I know that we've recently started collaborating much closer with Colin Lord in New York, but indeed, I think WPAT is a really amazing resource, and the region will be open to greater collaboration. So I just wanted to add that to your comment, Stefan. There's another question, Stefan, if you can take this, please. There's another question that's being asked, and the question is, what strategies work in terms of identifying and supporting the most marginalized members of the transgender community? Actually, it's a two-part question. What services and interventions do they need beyond healthcare?
Okay. All right. So so at Transwave, how I initially started with Transwave, because I didn't initially start through like a hiring or anything like that. I started as a volunteer. So initially, when I tried to discover myself, when I was in that process of figuring out who I really was, I had saw an ad on Facebook through one of our affiliate pages, and then I was asked if I asked myself rather if I wanted to be a part of the movement. I joined the movement, and then the executive director, Mr. Nish McLean, he held a very good relationship with me, as well as the then administrative officer, which is Noel. She held a relationship with me on a personal level. It moved on to Renee, which is the associate director of policy and advocacy right now. She also had that personal relationship with me, as well as many other members of the trans community here in Jamaica. And what we found is that through the personal outreach that we do with these persons, it makes it very much easier for persons to accept the work that we do and want to get involved with us. Could you repeat the second part of the question?
So the second part of the question is, what services and interventions do they need beyond healthcare?
Okay, right. So ideally, trans persons within the Caribbean are greatly discriminated against and stigmatized. They aren't offered the opportunity to express themselves. They aren't offered the space where they can go and just network with persons who are like-minded or persons who have the same understanding that they have. So a part of what Transit does is we create that space. In my role as admin and outreach officer, I have to actually think of smart ways to allow for members of the community to actually have fun, to actually be offered that space to be themselves and entertain and fellowship and talk about issues that affect them. One of those things that we do is our support group services that we offer on a monthly basis. We actually have that on pause for the moment. What we do is we had a psychologist come in, and she spoke with members of the community. It was sort of like an alcohol abuse session where we came in, we talked about our issues. Anything that was said in the session was not said after the session was done. We also have sessions where we would refer persons to one-on-one counseling from various psychologists or psychiatrists, and they would go and take advantage of those services. Additionally, one of the other things that we do is we try to make our events trans specific. We had a scavenger hunt whereby we had persons, the clues for the scavenger hunt were very trans specific. We also had a recent fashion show, which was gender freedom, which allowed persons to express themselves in the form that they felt ideally they could express themselves at and they felt most comfortable at. So these little things like those are some of the things that will help. I mean, there's also from time to time whenever we talk to persons and network with persons, we really allow them to define themselves. We don't go in and saying he, she, or the old lady. We actually allow them to identify with a specific pronoun, and then we use that pronoun in every instance that we're referring to them after. So some of those little things really do help a lot.
Thank you so much for that, Stefan. And if I can add maybe just very quickly to your response and to the question, to say that at PANCAP we've just concluded the South Learning Exchange to the Dominican Republic. And I just want to say kudos to some of the interventions that we've seen in a very small grassroots community-based organization called TRANSA. And so we've seen them addressing the needs and providing services beyond the healthcare. And so they do looking, for example, at things like housing, things like making food available to some of their population who would need that kind of support. So there is that, I think, some of the other social issues that affect the population. I just wanted to share, maybe there is two comments, not necessarily questions. So I'll read those comments and I'll hand you back to Lucian. One comment is saying, I would like to raise awareness over WHO's director report on the access and use of health services by LGBT persons. This report, approved by member states, is an important advocacy tool, and the link was shared. We will share the link with attendees once the webinar is closed.
Okay.
And then the second comment is PAHO WHO also has a blueprint for the provision of comprehensive care for trans persons and their communities in the Caribbean and other Anglophone countries to help healthcare providers and countries. And the link has been shared. We will share those links with you once we close the webinar. I hand you over now, back to Lucian.
Okay, so just before you do the handover, I'd like to make an additional comment. So we also have a part of our support services at Transgender. What we would normally do is that we would have care packages that we distribute to members of the community who find it kind of hard to actually care for themselves in that special way. So we normally have care packages that we would actually distribute to those members once it is that they request them. Additionally, we do have an emergency fund set up, which we use for any emergency that persons may be facing and they need that additional support. So those are some of the other ways that we assist members of the community as well.
Thank you for that additional comment, Stefan. I believe we have about 10 minutes left. If we can, John, are you there?
Yes, I am. I'm not sure if you can hear me now.
Yes, we can hear you now, and we thank you for continuing to try to get on. We have about 10 minutes. Can you grace us with some of what you had planned for us today?
Yeah, sure. So I might
Yes,
skip over some stuff. But essentially, I wanted to talk a little bit about the importance of visibility and knowing how many trans persons we have in the Caribbean, and because that's really the basis of a lot of the strategic information, which is so critical, you know, when it comes to programming, when it comes to policy, when it comes to making a community visible. So I wanted to share with you a little bit about just trying to get this to move. Oops. A little bit about a study that we recently completed in the OECS. And in the OECS, essentially we did a population size estimate precisely to be able to have a better idea as to the numbers of different key populations in the OECS. And we specifically looked at MSM, trans women, and female sex workers. So I think what is important is that it was the first time really in the OECS and in many countries in the Caribbean that population size estimates have actually been done. And so typically we don't collect data about gender identity. So it's not a demographic variable that is available to us. And generally, if somebody is a trans woman or a trans man, if they're a trans woman, they appear in the statistics of males who are biological males. And if the person is a trans man, they appear in the statistics that have to do with biological females. And hence, we don't have the specific healthcare needs that are so important for transgender persons, because those individuals are lost within you know, the binary gender classification that's used. And as a result as well, we don't regularly collect information, health-related information about the trans population. So this is at least a first step in terms of being able to quantify how many trans people there are. And I'm going to skip some of this because I know we're really short of time. But one of the things I think that was very clear in this study is that because of the environment that the trans persons live in the OECS, many of them were very reluctant to identify as trans. And so one of the things that we found was that a large number of individuals who, by using the definition of trans in terms of being a person who identifies with a gender that is different from their biological sex, when we asked people about whether they identified as trans, we had a percentage that identified as trans, but we had an even larger percentage that identified as female over the male gender, but didn't perceive themselves per se as being trans women. And so I think a lot of this has to do with the environment. Also, some of it has to do with that journey of understanding yourself and how you feel. And I think there's a lot of work that needs to be done in the OECS on those issues. Because when somebody does say that they identify primarily with the female gender, then it is somebody who doesn't have a gender identity that matches their biological sex. So we did a study. In the study, we had a sample size of 1,329, including MSM and trans, and about just under 160 of the participants identified as either trans or as predominantly female. So when you actually look at the data specifically for that subset of individuals who are identifying as trans, we see that there's quite substantial differences in terms of the results when compared to individuals who are identifying with, MSM who are identifying with the male gender. So we found that about just under 8% of the respondents identified as female, with about 3% that identified with both male and female genders, and only 4% specifically identified as transgender. But if we look at these numbers jointly, just under 12% of the sample size had a gender identification that didn't fully match their biological sex. So we also noted that there was some substantial differences between countries. And so you can see on this slide that almost 15% of the sample in Antigua identified as with a female gender, and on the opposite end in Grenada, 8.7%. So on average, it was just under 13% of the sample size. So in terms of some of I'm just going to mention some of the broad brush strokes in terms of the study highlights. Those who identified as trans or female were much more likely to identify as gay or homosexual compared to masculine identifying respondents. They were much more likely to have disclosed their sexual orientation to family when compared to the masculine identifying participants. We also found that they were much less likely to have used a condom when being topped in the last year compared to the masculine identifying respondents, and they were much less likely to have used a condom, period, in their last sexual encounter with a casual partner, which obviously is the most risky type of partner, than those who identified as male. Oops, well, a little bit too quick there. So we also found that the female identifying and transgender participants were more likely to have engaged in sex work compared to the others. They were less likely to have reported having sex with women, almost half the percentage compared to those who identified as masculine or male. And they were much more likely to report being excluded from family gatherings. So 32.4% explicitly mentioned that they had been repeatedly excluded from family gatherings compared to 17.5% for those who identified as male, and also in terms of their experiences of stigma and discrimination, measured by discriminatory marks, violence, and a series of other things. So we also noted that they were more likely to avoid seeking healthcare services for fear of being outed. They were twice as likely to report being treated badly at healthcare facilities than their masculine identifying counterparts. And they were much more likely to report being verbally harassed or physically assaulted and sexually abused. And I don't really have time to go into the detail, but certainly you can see here in terms of whether it's verbal harassment, physical abuse, or sexual abuse, the blue columns being the trans compared to the masculine identifying MSM. Just to give you an idea of the numbers, in terms of the calculations that were done, we estimated that there was a median of 153 trans in Antigua, 170 in Grenada, 168 in St. Vincent and the Grenadines, 104 in St. Kitts and Nevis, and 306 in St. Lucia. So although we're talking about relatively small numbers, nonetheless, there's a significant number of trans, and even in the small islands of the Eastern Caribbean. And so with this study, we begin to be able to quantify and visibilize those populations. Thank you.
John, thank you. That was swift, but I think quite interesting. One of the things that you mentioned was that people were quite reluctant to come forward, and so I many of the steps we agree are necessary on the path to zero discrimination to visibilize the communities that we work with requires some amount of visibility, some amount of cooperation of the community itself, which presently in many instances has to happen in a climate that could have significant risks and consequences. So how do we bridge that gap, John?
Well, I think it's certainly a huge challenge, and I think we need to be very careful asking people to, in the public good or in the interest of others, to come forward and put their own job or family situation or whatever at risk. That definitely is something that's a big concern. And trying to balance the need for data, but at the same time, realize that if somebody is outed or if this data results in somebody having their identity disclosed, I mean, that's something which, can have really important consequences for that individual. And so, yeah, I think certainly in the study, we took extraordinary measures to maintain confidentiality, but at some point, there is a need for individuals to come forward. One of the things that's interesting for me is that, we also did a study in Belize, and one of the things that one of the trans participants mentioned to me in Belize was that, in a sense, because of the way I present, and the need for me to present my female gender, it actually means that I find it's actually safer for me to present as a female, because when I was more androgynous, I attracted a lot more attention, and I find I was a lot less safe. So, for example, you know, if they were to get on a bus, presenting as a woman, you know, maybe nobody really would notice very much. But if you present as somebody who is very androgynous, that could actually be more risky. So I thought that was something that was interesting, because we assume that, you know, the greatest risk is for individuals who are living as a woman every day. And that might not necessarily be the case, particularly if somebody is passable as a female.
Yeah, that seems to be um, an interesting factor, the passability that renders an individual at risk or not. Stefan, any comments at this point?
Lushan, just before Stefan respond, just to let you know, there are a few questions lined up.
Yeah, sure.
Okay.
Can we have some of those, because I cannot actually pull them up?
Yeah, thank you. So there's a comment for Stefan. Somebody saying thanks for your responses on your presentation on your responses, Stefan. And then there is a question, John, for you. Was the study focused only on men? There was that question. And then we have a sort of question slash comment. Someone saying that in August, healthcare workers in Vienna benefited from a one-day workshop with Dr. Asa Radix, a doctor Colin Lord, and a member of the board of directors of WPATH. The activity was very successful, but Dr. Radix was concerned about the use of hormone therapy, especially among our trans female. Dr. Radix had a close session with a group of 30 trans persons, and he noted that some persons were taking as much as 5 times the dose of hormones without any guidance from a doctor. Person would like to know, is this the case in other countries? And continue to know that we realize that this is happening because of fear of accessing health services, and most persons prefer to get hormones over the counter. So a look at hormone therapy or giving guidance in hormone use is something we have to consider as part of the care provided to our trans persons with HIV. The trans people need to be empowered to be able to better bridge that gap. I believe we need to get more trans women and trans men involved. Sorry, I meant to say, who was the demographic focus of the study? That's the question about whether it was just men. The person is clarifying that they're asking about the demographic focus of the study. And then there's a comment from another attendee who said that I find these estimated number of trans in these islands to be quite high. So sort of two questions and a comment on the use of hormone therapy on among the trans men population.
Okay, so I think I can comment on the use of hormone therapy specifically for Jamaicans based on what I do know. So presently in Jamaica, there is, because I'm not sure if everybody knows the process that it takes for you to actually start using hormones. You have to speak with an endocrinologist, you have to go to the doctor, you have to get your hormones tested and all of that. I do know that currently there is one organization that we reference persons to whenever they want to talk about hormone treatments and so forth. And I do know that that one organization deals with a vast majority of the trans persons in Jamaica that want to undergo hormone therapy. I do know persons that are on hormones right now, but it's not at that level that there's a lot of persons. It's quite minute, to be honest. Right, and then additionally, there's also the issue of access to these persons who are trained specifically with offering the support needed for hormone therapy.
I don't know, John, do you have a comment on the demographic of the study?
Yeah, I mean, in terms of the focus was on MSM, trans women, and female sex workers. So we did have specific questions for individuals who identified either as a trans woman or somebody who had indicated that they identified with a female gender, answered questions that the other participants didn't answer. So there was a focus in terms of the trans women as well as MSM and the female sex workers. I think the comment made about the numbers is a very interesting one. And I think what we tend to forget is that, in terms of the numbers, we're not talking about these are the numbers of individuals who live as women on a daily basis. And that, because that's not what being transgender is, right? So I think in the OECS, for understandable reasons, there's a very small number of individuals who risk living as a woman every day, right? But that doesn't mean to say that there aren't many individuals who, if the environment were different, if they felt safer, if it didn't involve them not being able to work and function as part of society, then there may be a lot more individuals who would express their their femininity or their female gender. So I think that's sometimes why maybe the numbers are a little bit surprising. We countless times heard from people who said, I don't present as a woman. I don't, other than for parties or in particular private events or in the privacy of my home, I'm not able to live how I feel I would like to live. But those individuals are very much transgender persons.
Shanti, is there another question that was in the section? I also want to remind us that the poll has been put up. Question is, what in your opinion is the topmost priority for transgender persons in the Caribbean? And it seems that we have a tie between achieving gender affirming legislations and policies and economic empowerment.
Lucian, at this point, there are no other questions, so you please do go ahead.
Alrighty. So with that, I think we're about 10 minutes over, which I think makes up for the time we lost due to all the technology that we're trying to grapple with. We do wish to thank you for your participation and the presenters, obviously, John, Alexis, and Stefan. We do invite you to the next webinar. And on behalf of PANCAP, the director, Mr. Derek Springer, as well as the chair of the Knowledge Management Working Group, Ms. Adrienne Martin, I would like to thank you for your participation. The recording of this webinar will be placed on the website. And so at any point after it has been placed, you can access it and go through the information again. So thank you, and we hope to see you at our next webinar.